Length of male and female urethra. Male 18 to 21 cm. Female 3 to 4 cm. Parts of male urethra. 1. Prostatic. 2. Membranous. 3. Bulbar. 4. Penile. Proximal posterior urethra include prostatic and membranous urethra. Distal anterior urethra include bulbar and penile urethra. Which part of urethra pierces urogenital diaphragm UGD? Membranous. Which part of urethra is most distensible and which is least distensible? Most, prostatic. Least, membranous. Which part of urethra is shortest and longest? Shortest, membranous. Longest, penile. Which part of urethra is bend? Bulbar. Narrowest portion of male urethra. External urinary meatus. What's RGU and MCU? Asterisk RGU retrograde urethrogram, dye inserted through penis. Delineates in distal urethra. Asterisk MCU, micturating cystourethrogram, dye injected in bladder, micturates. Delineates in proximal urethra. For the diagnosis of VUR, vesico-urethral reflux, which among these is used? RGU, MCU. MCU. Covering of penis. Skin. Superficial dartos fascia. Areolar tissue. Deep buccal fascia. Tunica albuginea. Erectile tissue in penis. 1. Corpus cavernosum paired, dorsal, don't contain urethra, primary tissue for erection. 2. Corpus spongiosum, single, ventral, surrounds urethra, prevent closing of urethral opening during erection, so allow ejaculation. The landmark verumontanum is located in what part of urethra? Prostatic. What's hypospadias? It's congenital anomaly where external meatus is situated premixal than normal, over ventral under aspect of penis. Clinical features of hypospadias. Downward directed stream of urine. Chordae. Hooded prepuce. Undescended testis maybe. Micropenis maybe. Types of hypospadias. Glandular, mildest. Coronal. Distal penile. Mid-shaft. Proximal penile. Peniscrotal. Scrotal. Perineal, most severe. Most common type of hypospadias. Glandular. What's chordae? It's abnormal downward, ventral bending of penis. More prominent when erect. Management of hypospadias. Surgery at 6 to 12 month age. Circumcision avoided, as foreskin used for reconstruction. Principles of repair in hypospadias surgery. 1. Orthoplasty, chordae correction. 2. Urethroplasty, resection plus tubularize urethra. 3. Glanduloplasty, glands reconstruction. 4. Skin cover. Name of surgeries for distal hypospadias. Matthew, Mustardi. Name of surgeries for mid-hypospadias. Snodgrass, Tip. Name of surgeries for proximal hypospadias. Thiersch Duplay, Dennis Brown. Two-stage repair. Complications of hypospadias surgery. Infection. Meatal stenosis. Urethral cutaneous fistula. Stricture. Chordae recurrence cause of fibrosis. What's ectopia vesicae? Anterior abdominal wall and anterior wall of bladder are deficient below umbilicus. Testis are normal, umbilicus absent. Clinical features of ectopia vesicae. 1. Red mucous membrane of posterior bladder wall protrudes and visible urine dribbling from bladder. 2. Separation of pubic bone, pelvis diastasis. 3. Bilateral congenital inguinal hernia. 4. Repeated soakage and pain. Complications of ectopia vesicae. Recurrent infection, stricture, renal failure. Site, mode of injury, and features of anterior urethral injury. Site, bulbar, penile. Mode of injury, direct trauma, cycling, loose manhole cover, gymnasium, sailing. Features, superficial perineal hematoma, butterfly-shaped hematoma involving scrotum and penis. Site, mode of injury, and features of posterior urethral injury. Site, prostatic, membranous. Mode, secondary to pelvis fracture, prolonged labor, catheterization. Features, perineal hematoma involving anterior abdominal wall and upper 1/3 thigh. Vermeulen sign. What's Vermeulen sign? It's high-riding floating prostate André. Because prostate is attached to pubis by puboprostatic ligament and its disruption causes floating prostate. Clinical features of anterior and posterior urethral injury. Blood at tip of meatus. Inability to pass urine. Management of urethral injury. 1. Never insert Foley catheter, can cause complete tear. 2. If bladder is full, do SPC, suprapubic catheterization. 3. If not full, wait till full bladder plus 1 trial of micturition. 4. IOC, RGU. Manage stricture. Stricture management in urethral injury. If short, incomplete, pass guide wire, optical internal urethrotomy. Short, complete, resection plus end-to-end anastomosis. Long, complete, resection plus graft to bridge gap. Most common graft used in management of long, complete stricture in urethral injury. Buccal mucosal Barbali's technique of urethroplasty. What's fracture shaft of penis? It's tear in corpora cavernosa or tunica albuginea on erect penis due to vigorous intercourse or trauma. Features of fracture shaft of penis. Sudden popping sound, pain and swelling. Eggplant deformity of penis, swelling, bruising, deformity in penis. Management of fracture shaft of penis. Surgery drain hematoma, repair tear. OCPS for 1 month post-op to prevent erection. What's posterior urethral valve disease? It's abnormal fold of tissue in posterior urethra that block urine outflow in male infant or child. Seen only in male. They are one-way valve, allow passage of catheter without resistance but obstruct urine. Clinical features of posterior urethral valve. 1. Recurrent UTI in male child. 2. Hydronephrosis. 3. Thickened and hypertrophies bladder, palpable in suprapubic region as firm swelling cricket ball bladder. Classification for posterior urethral valve. Young's classification. Type 1 MC, 2 mucosal fold from verumontanum. Type 3 Cobb's collar. Diagnosis and management of posterior urethral valve. Diagnosis, MCU, keyhole defect seen. Management, fulgration of valve. What's Peyronie's disease? It's bending as penis towards plaque, due to formation of fibrous plaque which calcifies later within tunica albuginea. Pronounced under erection. Slow progressive disease. Clinical features of Peyronie's disease. Difficulty intercourse. Associations. Dupuytren contracture, retroperitoneal fibrosis, plantar fasciitis. In initial phase bend increase and painful reception. In late phase bend constant and painless. EO for Peyronie's disease. Emery. Palpable on examination. Management of Peyronie's disease. Asterisk first line. Injection, collagenous Clostridium histolyticum, Shiflex, it dissolves fibrosis. If fails, Nesbitt procedure aka 16. Technique, counterbalancing bend with contralateral non-absorbable suture. Excision of plaque. What's priapism? Persistent prolonged painful erection. Greater than 4 hours. If greater than 6 hours, ischemia, gangrene occur. Types of priapism. 1. High flow, due to increased inflow of blood. 2. Low flow, due to venous blockage MC. Causes of priapism. High flow type, secondary to trauma, papaverine injection, spinal injury. Low flow type, children's, sickle cell anemia, leukemia. Is priapism painful or painless? High flow type, painless. Low flow type, painful. Which erectile tissue is involved in priapism? Corpora cavernosa. Glands and corpora spongiosum not involved. Management of priapism. Sedation, adrenaline vasoconstriction, if persists, shunt surgery, gray hack shunt. If persistent high flow priapism, embolization done. Penile cancer type and MC gene mutated. Squamous cell carcinoma, P53. Name of verrucous carcinoma of penis. Buschke-Lowenstein tumor. Premalignant conditions for penile cancer. 1. Bowen's disease. 2. Erythroplasia of Queyrat. 3. Balanitis exotica obliterans, leading to phimosis. 4. Genital wart, HPV. 5. Leukoplakia. What's Bowen's disease? Sunburn appearance over penis, reddish papules, on shaft. What's erythroplasia of Queyrat? Sunburn appearance over penis, reddish papules, on glands. Clinical features of penile cancer. In adult, recent onset of phimosis. Ulcer proliferative growth on penis. Lesion is painless initially, later painful. Foul smelling. 50% have inguinal lane involved D. Staging for penile cancer. TNM. Jackson's staging. Management of penile cancer. 1. Bowen disease, topical Fu cream. 2. Primary tumor, if away from root of penis, partial penectomy. 3. If close to root, total amputation. 4. Chemotherapy 5-FU, cisplatin. Most common cause of death in penile cancer. Erosion of femoral iliac vessel due to lane. What's phimosis? Inability to retract foreskin after 6 years of age. Because physiological phimosis 2 to 6 year. Inflammation of glands is called balanitis, common in diabetics. What's inflammatory of glands, prepuce, and sac is called balanopostitis. Symptomatic phimosis. Can't retract foreskin, recurrent UTI, ballooning of foreskin, balanopostitis. Management of phimosis. Circumcision. Post-op complications of phimosis. Hemorrhage, frenular vessel, infection, cordy formation. What's paraphimosis? It's when foreskin forms a constricting ring around penis, leading to necrosis and gangrene. Management of paraphimosis. Conservative, xylocaine jelly then reduce foreskin back. If failed, dorsal slit surgery. What's most common congenital urogenital anomaly?